I'm Dr. Omar Bay, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and I would like to emphasize caring and sharing. Because I just think these words mean so much. If we care about each other, if we share our medical problems, which doctors are good, which doctors you like, which doctors are, have done a good job for you, tell somebody about that doctor. That other person just may be stimulated to go see a doctor and take care of their medical problems if they know they're going to be met by somebody who really cares about them. Also, this year, we're going to focus a lot of our attention on weight loss because I truly believe if we could all lose, say, 10% of our weight and come down towards our ideal body weight. Your ideal body weight is that amount of weight that's appropriate for your height. If you could come down towards your ideal body weight, guess what? We could decrease hypertension, diabetes, heart disease. So many things could be improved just by losing weight. That's our goal for this year. All right, guys, remember, we're on Instagram, Obey Your Doctor. We're on our website, that's obeyyourdoctor.com, and Facebook, Obey Your Doctor as well. We are even on Twitter, so obeyyourdoctor.com. Go check us out. We got a lot of things on there, a lot of interesting medical tips that will help you throughout the year. Okay, let's talk. Let's talk about a topic that it's cholesterol. All right, and reducing your cholesterol, because increased cholesterol can really lead to heart disease and other diseases, clogging up the arteries, things like that. So let's talk about decreasing your cholesterol. Oatmeal. Oatmeal in the morning is a great little breakfast, but guess what? It decreases that cholesterol, that LDL, the bad cholesterol, the one that clogs up your arteries. Oh yeah, that oatmeal. And figs, as well as walnuts, they're very good as well. So what we're talking about is we're talking about our diet, and we're talking about decreasing the saturated fats. And saturated fats come from things like red meats, cheeses, and fried foods. Those three are the culprits, and we need to bring those down so that we can decrease that LDL cholesterol. Okay, there are other things that we can eat, just like nuts I talked about. Exercise is very, very, very important. Being active, and vegetables and fruits. Definitely. Fish, things like salmon, those omega-3s, all good. So these are some of the tips that we want to let you know about so we can decrease those LDL cholesterols. All right, let's get to the topic today. We're going to talk about prostate cancer. And prostate cancer for men is a major, major problem. But it's one of those type of diseases that we can really do something about when we catch it early. And that's the greatest thing about it. Catch it early. So I have an expert in this field today, and we're going to discuss this topic. His name is Dr. Trevor Lane, and he is a board-certified medical oncologist. Dr. Lane, welcome to our show.
Thank you for having me.
All righty. I'm so glad that you could take some time out of your busy schedule. I know as physicians, we're all busy, and you've come here to talk about this problem because so many men should be more aware of prostate cancer.
That's correct.
The first thing I'd like to do is just give us a few words about what is cancer, basically.
Cancer essentially is where there is an uncontrollable growth of a cell. Mm-hmm. Most times when cells grow and they touch each other, they should stop growing. Something happens within that cell that causes the cell to go rogue, as it was, to just keep growing and growing and growing. Mm-hmm. And usually that's because of DNA malformation, some kind of translocation, insertion, something in the DNA or the RNA that causes that cell to lose what we call contact inhibition. So when it grows and touches another cell, it doesn't stop growing. It just keeps growing and growing and growing.
Okay. Now, when you say DNA, that's the genes.
That's the gene. That's correct.
All right. So those are the genes that tell each cell in our body how many cells they should be grown, how they should duplicate, what their functions are.
That's correct.
And something happens in there
Right.
that makes this cell a little screwy.
That's correct.
And it just keeps growing and doesn't have any inhibition.
Absolutely.
All right. I know some people that doesn't have. No, I'm just, all righty. So it just spreads. Now, when it spreads, that means it can go other places. That's why it goes other places?
Yeah, when it essentially spreads, if it starts, for example, let's say in the prostate, it could spread through the nerve, through the nervous system, through the hematological system, through your bloodstream, or through your lymphatics. That's where it spread. And it seems that in prostate cancer, it tends to spread to a certain type of vein called the Batson's vein that goes directly to the bone, to the back. This is why lots of patients, the first sign they have a prostate cancer, that they have back pain.
Okay, you just hit some major stuff, and you went through it real quick.
Okay.
When it spreads, now those cells, the prostate cancer cells, and we're going to get more specific later, but you hit something. It can spread through the blood system.
That's correct.
And you said something, a word say lymphatics.
Yes, the lymphatics is like the fatty system in the body.
So that has routes that cells can travel through as well?
Absolutely. It goes through your whole system, the lymphatics.
All right. So it could be the blood system or through the fat vessels or the lymphatics that can spread these cancer cells to anywhere in the body.
And through the nerve sometimes. It can dovetail across your nerve and spread through your nerve also.
Okay. Now, prostate, where is the prostate? And tell me a little bit about this organ.
Well, and this is why it's so important, because the prostate is that organ between the bladder and the urethra, just at the base of the penis.
Okay.
The reason why it's so important is because the pudendal nerve, or the nerve that causes erection, in men runs through that prostate.
Okay, step back, man, because you're talking about serious stuff now.
Yeah,
Any man out there should be listening to this one.
Oh, yeah, they should be listening.
So you're talking about the bladder and urethra. What is a urethra?
The urethra is the area from the bladder to the end of the penis where the urine goes through.
Okay, so you have the bladder that holds the urine.
Right.
And then your urethra is the tube that allows the urine to come out through
correct.
the penis, and when you go to the bathroom and relieve yourself, that's where it's coming from.
That's correct. That's exactly where it's coming from. Yeah.
Now that prostate sits right at the junction of between the bladder and the urethra.
Right there. It has a very important function.
All right. How big is that bad boy? Is it like huge? If
I'm
walking around with a big one, then I'm a big.
It may weigh about 2 or 4 grams. It's not huge.
It's not. It's a small.
No, it's a small organ. Yeah.
All right. What's the function? What does it do? Why do we need it?
Well, what do we need the prostate? Well, first of all, as you get older, your prostate gets larger.
Okay.
But the prostate has a lot to do with essentially your manhood, your testosterone, with your hormones and stuff like that.
Oh, all righty. Yeah. So I must have a real big one then. All right then. So what we're talking about, and let's be serious for a minute.
Yeah.
We're talking about an organ that is near the bladder and the urethra, and it's very, very important to as far as sexual function.
Right.
But the thing of it is that as we get older, it can become abnormal.
As we get older, it becomes abnormal, and it essentially can stop the flow of urine from the bladder through the penis. So one of the first signs that people have is that they have difficulty going to the bathroom because the prostate, it gets bigger and it clamps down.
Right.
The base of your bladder, so the urine cannot come out.
Okay, so it pushes on that bladder, it pushes on that urethra, so the urine can't go through that tube very easily.
That's correct.
All right then. Okay. Yeah. Does it hurt when is it painful at all?
It could be very painful, or it could be a nuisance most of the time. And what happens is that when the bladder contracts, you don't empty your bladder properly. You find that lots of patients have dribbling. They would go to the bathroom 3 or 4 times at night to clear the urine. They would get up, they would go to the bathroom, they feel like they want to pee. They would just go in there, have a little bit of urine, a dribble, and then half an hour later they have to go back again.
Right.
And that's one of the first signs that your prostate is getting large.
Okay.
Usually you can have hematuria or blood in the urine.
Okay.
But that's usually a late sign. It's not a very early sign of prostate problems. The earliest sign essentially is just the dribbling and the fact that you cannot empty your bladder properly.
Okay.
That's one of the first signs.
Is every large prostate cancerous?
No. As you get older, your prostate gets larger. But you can have a large prostate that is cancerous, or you can have a large prostate that's benign. It's called BPH, or benign prostatic hypertrophy.
Okay. And benign means no cancer.
That's correct. That's correct.
Okay.
So not every large prostate is cancerous, but most large prostates probably will be cancerous in the long run.
Eventually.
Eventually, if you live
Okay.
long enough, yes.
About what age should men start being evaluated or being concerned
Right.
about this?
Well, the NCCN guidelines, the NCCN is the National Comprehensive Cancer Network. Most oncologists, we take our guidelines from there in terms of how we treat patients, and of course the National Cancer Institute. So the recommendations are that at the age of 40 for black men, you should start having a prostate test called a PSA,
Okay.
prostatic specific antigen, done every year, together with a digital rectal examination.
Okay.
Now, the rectal examination is the part that most men don't like. It involves someone putting a finger up your butt, as they say. So most men don't like that. But it is important that men do that. It's simply a 10-second examination.
Right.
So for white males, the recommendations are you probably start at 50 because, as you know, black men have twice the amount of incidence of prostate cancer as compared to white men.
Okay. All right.
So at 40 is when you really start screening for prostate cancer.
All right. Now, this PSA,
Yeah.
is it a blood test? How do they do this test?
It is a simple blood test. You go in doctor's office, he takes the blood, and that's it. Takes 2 seconds. And it's a very important test.
Okay.
Because the PSA is the screening test we have now to tell us if you have a large prostate, whether it's cancerous or not.
Okay. All right. So then if the doctor does the digital exam
Right.
and he finds that your prostate is enlarged,
That's
then
correct.
he'll do a PSA.
PSA, yes.
And then that will tell us, give us an indication whether there's cancer.
Right, because the normal value of PSA is between 0 and 4. And once it's over 4, we tend to want to evaluate the prostate. And at that stage, you want to do a biopsy of the prostate.
Now, biopsy is, you're talking about actually taking a needle and
That's
taking
correct. That's correct.
a little biopsy
Of the prostate,
and
yes.
sending it to the lab to see. Now, what do they look for at the lab? What are they looking? Are they looking for mucus or cells, or what are they looking for?
What they're looking for, the prostate is a gland. So when it becomes cancerous, the architecture of the gland changes.
Oh,
And that's what will tell you if it has become cancerous or not.
okay.
So this is what the pathologists look for. And the exam is done by the urologist. It's done through the rectum. It's a transrectal ultrasound-guided biopsy of the prostate. They take usually around 11 or so samples.
Right.
Because the prostate is a round organ. So they have to go around like in a clockwise direction, like a clock, and take about 11 samples and send that to the laboratory.
On each segment of
On
it.
each segment of it,
Right,
yes.
right, and then they'll send those away.
Yeah.
Now the pathologist, those are the doctors that actually look under a microscope, and look at the cells. Or you said this is a gland, so look at the glandular structure. Look at the structure of the gland.
That's correct.
To make sure that it's appropriate.
Right.
All righty.
Absolutely.
Okay. Talk about family history.
Family history is
Yeah.
very important, and that's important to me. I mean, on a personal note, my father died from prostate cancer.
Okay.
So men that have a first-degree family relative, like a father, with prostate cancer have twice the incidence of prostate cancer than regular guys. So the family history is very important. And we think that prostate cancer is just a male thing, but it really isn't, because it is linked to the BRCA gene for breast cancer, BRCA1 and the BRCA2. Especially BRCA2, there is an increased incidence of prostate cancer, also pancreatic and gastric, but prostate cancer. So your sisters and the history of your mother can somehow determine your risk of getting prostate cancer also.
Interesting.
Yes, it is not only from the man's side.
Oh,
Absolutely.
interesting. So just like father, brothers are just as,
Brothers is just the same, yes.
Is just the same, a
Yes.
link there. If you
Yes,
have
a
a
link.
brother that had prostate
Cancer,
cancer, you should be
You
concerned.
should be
as
concerned
well.
about it, yes.
All righty, all righty. Now, what about as far as, your diet and things you eat? Would that affect this at all? Maybe if I ate a lot of red meat or something like that, I would have more.
Yeah, there are some anecdotal studies that fats and red meats, and just simply to say that all the bad things that are bad for you are also bad for your prostate and bad for cancer.
Okay.
And I'm sure Dr. B, you would say a lot more than that, because that's your thing. But it is true, bad things. Also, if you dovetail, with breast cancer, if and in an ovarian cancer, those bad foods tend to have increased incidence of those cancers.
Okay.
Yeah.
Obesity?
Obesity.
Is there talking about bad foods and
Right.
stuff like that? Is that correlated in that as well?
I don't think it's a direct I don't think it's a direct correlation, but I think there's an indirect correlation because, of course, the obesity is caused by eating the bad foods. Yeah.
All right. Now, what about things like venereal disease? If you are an unfortunate person
Right.
and you've had it many
Right.
times,
There is no direct correlation. There have been studies that have shown that in some cases there may have been increased incidence of prostate cancer with people that have recurrent venereal diseases, and also something called prostatitis, which is inflammation of the prostate, which is not a venereal disease.
Right.
It's just an inflammation of your prostate, or epididymitis, which can cause increased incidence of prostate cancer. But these are very, very less common.
Okay, all right. And there's something, well, I don't hear about it too much lately, but in the past, vasectomy was the thing.
Yeah, vasectomy.
You know what I mean?
Oh, it's still done.
Oh, it's still done?
Yes, it's still done.
Oh, my goodness gracious.
It's still done.
Well, the thing
Probably
of it is,
more men should have it.
yeah, well, you're probably right.
Yeah.
But is there a correlation there?
There have been studies where there's a correlation between increased incidence of prostate cancer and vasectomies. But those studies were done in European studies. They weren't really American studies.
Tell me about early detection. All right, how important is it?
It is very, very important. And I would go on a limb to say now that no one really should be dying from prostate cancer.
Okay.
Prostate cancer is the #1 cancer in men, but is the #2 killer in men. The #1 killer in men is lung cancer,
Lung cancer, yeah.
right? Because this is a much more aggressive cancer. Prostate cancer and now there have been such an increase in the armamentarium in terms of how we treat prostate cancer. You hear all on the radio, the cyber knife and the IMRT and the freezing. There are so many modalities now that can help someone, especially if they're diagnosed early. So I'm going to go out on a limb and say that really no one should be dying from prostate cancer at this stage. So the early detection, you do the PSA. The PSA is slightly high. The urologist does the biopsy.
Right.
All right. When they do the biopsy, you get a pathology report. The pathology report gives you what's called a Gleason score. A Gleason score would tell you how aggressive the cancer is.
Okay, so, all right. So what we're talking about is that you've done the biopsy.
Right.
The biopsy goes to the pathologist who's the person that looks under the microscope and tells you whether it's cancer.
That's correct.
And then he puts it in a category.
That's correct.
Of how bad it is.
That's correct.
Called the Gleason score.
Right.
Okay, go
The
ahead.
Gleason score it goes from 1 to 10.
All right.
From 1 to 5 or 1 to 6 is not aggressive.
Okay.
6 and above tends to be aggressive cancers. All right. And usually most men with a Gleason score of 6 or lower that has an early stage, where the cancer is still in the prostate itself, most of them can be cured just by radiation or cyber knife.
All right.
All right. The ones that have the cancer that involve the capsule or outside the prostate, then it becomes a little bit more complicated.
Okay. All right then. So,
But now we also have, and for men, now we also have the robotic nerve sparing surgery, where in the past, if you had the surgery, it used to be like a rotor operation where they just go in and just take the prostate out.
Right.
So they would kill all the nerves. So men that had that surgery in the past became completely impotent.
Oh.
But now, through the robot, they can isolate the nerve and save the nerve and remove the prostate safely.
Okay.
So there is no real incidence of impotence that much more anymore in men that have prostate cancer.
Okay.
Because you can spare the nerve.
Okay.
And radiation also spares the nerve.
We're going to break this down.
Break this
So
down. Okay.
this is important.
Okay.
And to a lot of the men listening out there.
Okay.
When we talk about impotence, we're talking about not having the ability, or should I put, cannot get an erection.
That's correct.
All right. No matter what you do, since you've had that particular surgery or whatever the doctor did, you cannot get an erection
That's
after
correct.
that. Now we have procedures
That's correct.
that can spare that, and after the procedure, you can still have a normal erection.
Yes, you can
most
still
of
have,
the time.
yes, you can still have a normal erection most of the time. When the procedure was done, remember the nerve that causes erection runs through your prostate.
Right.
So when in the past they went and they just took your prostate out like a rotor operation, they would just destroy the nerve.
Right. Right.
But now they can actually go look at the prostate with the robot, with a huge microscope, isolate the nerve, and safely remove the prostate. So the man does not become impotent after having the surgery.
Okay.
So that is a very important thing.
Okay.
with prostate cancer now. So there is no fear anymore. Men should not fear. I think if you speak to some of the older guys, and probably the younger guys, they would be talking a lot about not being able to have an erection. So lots of guys would delay treating their prostate cancer, would delay taking care of the problem because of that. All right, but there is really no fear anymore for that. You know, there are doctors, and there are doctors right here in New Jersey. There are doctors in a urology group, and there are good doctors here that can do that surgery for you very, very safely at local hospitals, at Beth Israel, at St. Barnabas, you know, at St. Michael's. They can do those surgeries for you now. So there is no fear anymore to take care of your prostate. This is why I went on a limb and said no man should be dying from prostate cancer now anymore. Absolutely.
How do most patients present in your office when they have this problem?
I think most men are becoming better at taking care of themselves. Probably because the wives or the girlfriends are bothering them and saying that you're up all night and you have a problem. So usually the patient comes in with urinary frequency, urinary urgency, dribbling, getting up 3 or 4 times a night to go to the bathroom. And these are the patients that we really love to see because we know that usually it's an early case of prostate cancer. Some people also still present with bone pain and back pain because prostate cancer tends to spread to the bone very easily, very early. So that's the 2 most common presentations. Rarely someone will come in with hematuria or blood in the urine. The patients that present with that usually have bladder cancer in my experience. But with prostate cancer, usually it's just the dribbling and the urinary frequency and the urgency and not being able to clear your bladder at the first time you go to pee. You have to go 3 or 4 times a night.
All right then. Is this a fast-growing tumor or cancer?
No, it is not a fast-growing tumor. Prostate cancer is kind of a sort of semi-slow-growing tumor. It does not. If you have an early-stage prostate cancer, a T1C, for example, and you do nothing about it, it probably will not spread for 10 to 15 years.
Interesting.
If you have a low Gleason score, yes. If it's not an aggressive type of cancer. So it is not. And that's one of the problems, I think, with men. They don't tend to they don't tend to deal with it because they have no symptoms and they have no pain. And this is one thing I always tell my patients. They would come in and they would say, well, Dr. Lynn, I have no pain. I'm feeling fine, I have no pain. And I would tell them that cancer doesn't hurt you until it's about to kill you. And if you have no pain, that's when you have to take care of it. This is your golden period where you have to deal with the problem. Once you have pain, it probably has spread to another organ system. It's probably incurable. It probably has spread to your bones. So pain is the last thing you want to have when you have cancer.
Interesting. How risk factors? Are there any true risk factors that something I can avoid to prevent this from happening, or are there really no real risk factors out there?
The risk stratifications are for black men, of course, you have twice the incidence. Age, there's a higher incidence of prostate cancer as you get older. Obesity, stuff like that. And essentially the DNA factors that we spoke about, the BRCA2 gene and stuff like that. So, and the infections, the inflammations, or there have been some trials with that and there have been some studies with that. Prostate cancer.
Survival.
Survival for prostate cancer is extremely good. So if we go back to when the cancer is diagnosed, if it is diagnosed as a stage 4, that means it has spread to your bones. It's advanced stage. In patients that have stage 4 prostate cancer, their survival is somewhere between 15 20 years these days, because we have such a good medications now. Not only the CyberKnife and the IMRT and the radiation, we treat prostate, but there are lots of pills now that are coming out that are anti-androgen pills, where patients are treated. And essentially, the PSA can go from 500 to 0 in 3 or 4 months. So survival with prostate cancer is very good, and the quality of life is also very good, because although there are some patients that have to get chemotherapy, most patients probably don't have to get chemotherapy. And they can take a pill. They can take an Xtandi pill or a Zytiga pill, and it does wonders for them.
So these pills, you said anti-androgen. Explain that a little bit. I understand testosterone and stuff like that.
Yeah, well, that's the
tell
male.
me what-
But that's the male hormone. That's where the
Okay.
testosterone is converted in the cells.
Okay.
All right. So what we do is that testosterone sort of feeds prostate cancer. So if you have a patient that has stage 4 prostate cancer, you want to bring the testosterone level down.
Okay.
All right. So you give them a medication that blocks the conversion of the testosterone.
Okay.
So it kind of stops the testosterone in the tracks and decrease that level.
Okay.
There are lots of pills like that now.
Okay. So what we're talking, because we're going to wrap it up here because this is such a great discussion. I trust we had more time. What we're talking about is that the testosterone changes into androgen.
Right.
All right. And the medication, what it does is it tries to decrease.
Right.
Tries to decrease this testosterone androgen conversion.
Right.
And that way, the prostate is the cancer doesn't
doesn't spread. Right. It doesn't get fed anymore. It kind of takes away its food, kind of thing.
Okay.
Yeah.
Is there any other aspect that you would, the last 30 seconds that we have, that you want to emphasize that we didn't go over, because I know there's just so much about this?
But also, if you have a large prostate and it is not cancerous, and it's just a huge prostate, there are pills you can take to shrink the prostate. And there is a procedure called the green light laser now, whereby they sort of liquefy the prostate. It's done as an outpatient. You would go in through the rectum, it's a laser, and it just essentially liquefies the prostate so it shrinks.
Right.
So there are lots of really good things now for prostate cancer. The old adage of the man has to be sick and they'll be passing blood in the urine, these things are of the past. There's a very good treatment and there are very good doctors in this area of New Jersey to treat prostate cancer.
All righty. Well, thank you very much. We've run out of time. Dr. Lane, thank you for coming in.
Thank you.
All righty. So, in closing, remember, sharing and caring. All right, guys, we have to talk to each other about problems, and don't be afraid to go to your doctor. Why don't you grab a friend if you're a little afraid and take them with you, or a family member. It's so important to see your doctor. Remember, look at us on www.obeyyourdoctor.com. We're on Facebook, Obey Your Doctor, Twitter, and Instagram. Check us out, all righty? Never institute any change in your medical care until you see your doctor. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.